Hello, and welcome to the fourth lecture of our immunity lecture series, where we will continue talking about innate immunity, and we'll round it up with inflammation and fever. And we'll discuss what acute and chronic inflammation is and what fever is. And here we are going to describe acute inflammation. It's what we think of when we typically have inflammation, and remember, its main goal of inflammation is to recruit the agents or the blood cells or the supporting cells and enzymes that we need to close up our wound and prevent infection. Okay, so inflammation is mostly beneficial, and a lot of times we can see it and we can get itis. Okay, remember the itis is the suffix of inflammation. Tendinitis, endocarditis, encephalitis, a lot of itises, okay? And so it typically, we want to limit the swelling, we want to limit the amount of pain that we have and the swelling that we have in the itis and the inflammation regions. But what it's actually doing is trying to help us, okay? And then uncontrolled inflammation is bad, but most of the time it does what it needs to do. You add some ice, and the cells can still get recruited nonetheless. So, what actually happens? Well, let's imagine you get a small cut. Okay, it can be a paper cut even. The pathogens will readily see the new food, the new food source that was sterile, and now they can get in readily and start to populate the open wound. They'll use the blood, just like on a blood agar plate, and they'll perform hemolysis if they can, and stay alive that way. If they get too far down and out of the oxygenated regions, they need to be an obligate anaerobe, right? So a lot of things coming together in this example. So those mast cells will detect the fact that these pathogens are releasing agents into the cut, and they release histamines. The histamines work as chemical signals, okay, and they are going to increase the blood flow to the site. That increased blood flow will allow more and more red blood cells to come. It will also swell it up a little bit, and it causes it to feel warm, okay? And so the inflammation is associated doing with these events, stimulating the nerves that are nearby and in here too, right? Because we have nice nerves on our skin as well. Okay, so we've increased blood flow, we've increased sensitivity, and now our blood cells will get to it and start attacking those pathogens. Okay, we don't want them to get us sick. And so these create a list of signs that we can categorize, and you can imagine it's a numbered list. Okay, erythema and edema come first, okay, followed by heat, then the pain. The pain comes once we start triggering some of those nerve cells, so it takes sufficient swelling to do so. And then finally, altered function. Again, it's not cognitive altered function. It can be like, oh, I can't move my finger because it's so swollen, right? Oh, can't move my ankle because I sprained it so hard. Um, so, right. And so in that sprained ankle example, there's no cut and there's no pathogen, but we've still kind of triggered some of these inflammatory responses. Okay. And so there's a type of inflammation that you can get when you never subsides, okay? And so that's called chronic inflammation, and you'll just always be suffering from some kind of inflammation, okay? And they can be present in these granulomas, which create the chronic inflammation, okay? And so, yeah, it's not terribly common, and it can happen once a patient gets sufficiently sick, and they're just kind of contain it rather than eliminate it. Next, we'll end with fever. Okay, so fever. What is fever? Fever can be a lot of things. fever can be, above 98.6, or you can categorize it as over 100, or anything like that. Point is that the fever is controlled by this tiny region in our brains called the hypothalamus, where we are trying to limit the amount of effectiveness that the pathogen brings to infect you, right? So if they work optimally at body temperature, and they've evolved to work perfectly at 98.6 degrees, then the little bit of degree change is going to make them work a little less efficiently, giving your blood cells the edge in that battle that can operate at a higher temperature than those pathogens can. Okay, so that's the goal. Again, fever seems kind of counterintuitive. We want to limit a fever a lot of times, um, and that is true. But again, fever is designed to actually be helpful for you rather than to kill you, just like inflammation. So it's just uncontrolled inflammation and uncontrolled fever that we need to worry about. And those are usually from the more severe pathogens. Okay, well, that concludes our innate immunity series. And we will go into adaptive immunity, where we'll learn more about some blood cells, and we'll learn about how the fluids and antibodies and all that good stuff that we see in adaptive immunity. See you then.